It's good to see you again. How have you been?
I've been all right. My arthritis has been acting up.
I'm sorry to hear that. How long has it been since you were diagnosed with juvenile rheumatoid arthritis?
About 5 years now.
How did you know you had arthritis? Can the doctor just tell?
Well, I'd been having joint pain, and my doctor examined me for symptoms, but the only way to know for sure is through a series of tests.
What kinds of tests?
For one, I had x-rays of my joints done to check for inflammation or infection. After that, there is a set of tests that may or may not be performed.
So there isn't just one test that can test for juvenile rheumatoid arthritis?
No. The doctor has to review the results of several different tests in order to make a diagnosis. They have to make a judgment call based on the outcomes of the tests.
I see. What type of tests are they?
It is a battery of blood tests.
What kinds of blood tests?
RF, ESR, HLA-B27 typing, ANA.
Whoa. How do you remember all of those?
Once you learn what they are, it's not that hard.
Could you please explain them one at a time for me?
Sure. RF stands for rheumatoid factor. Rheumatoid factor is an antibody produced in the blood of people with some forms of rheumatoid arthritis. The higher the level of rheumatoid factor, the more likely you are to have rheumatoid arthritis.
And the second one? ESR?
That's the erythrocyte sedimentation rate, or SED rate for short. It helps to detect or monitor autoimmune disorders, like my arthritis. It measures the inflammation rate in the body by measuring how fast red blood cells settle to the bottom of a test tube. This rate usually increases in people with inflammation in their bodies.
What was the next one? The one with the really long name?
HLA-B27 typing. It is a blood test that tests for the existence of the HLA-B27 antigen. If the test results come out positive, it supports a diagnosis of inflammatory diseases such as juvenile rheumatoid arthritis.
What is an antigen?
Antigens are substances that, when introduced to the body, trigger the production of antibodies by the immune system.
Oh, okay. Didn't you mention another type of test?
Yes, I did. It was the ANA test.
What does that stand for?
ANA stands for antinuclear antibody.
So what does it test for?
It is used to detect autoimmunity, which is when your body attacks itself.
Alright, I think I understand a little bit better now. It must have been quite a hassle to go through all those tests to find out whether you had juvenile rheumatoid arthritis or not.
It wasn't too bad. At least now that it is diagnosed, I can get treatment for it.
That's true, I guess. It would be worse to not know and just live in pain all the time.
Yes, definitely. Well, it was good to see you. We should do this more often, just chat between you and me.
You're right. For sure, we'll do this again.